Morning. My name is Frederick Osafo of Indiana State University, a nursing student, and I'm taking community health nursing. And I'm going to lecture on cigarette smoking among middle school students. This session is on smoking with the middle school and high school student. What is the harm? I would like you to take a pre-test so I can get an idea on what you know about adolescent smoking. And then at the end of the session, post test to see if I may or if I did my job of teaching you the fact on adolescent smoking. Factors associated with risk of smoking in the middle school and high school student. This is a report on the smoking and how it affects middle school and high school students in the community. The community involvement is always wanted in any health related issue. The question is how important is it to educate the community on a subject that affects our children when it's not supposed to be an issue? The first concern is lack of education in the middle and high school students. The second concern is why is smoking among our children an issue when it is illegal? Third concern is since our children have access to smoking materials, why isn't education for our children to explain the reason not to smoke? Now is the time to provide information to our children and students so when they come into a situation where smoking materials are offered by shady people, our children can make better and a smarter decision not to smoke. The goal is also to protect our children and the children of our community, but we cannot involve in every health decision. So education is the key to make a healthy decision. These are some of the population at risk. You know, it's the middle school and high school students. The age, the population, rural and urban community. Cigarette smoking was more prevalent in more affluent high school with more white students. Adolescent substances use and influenced by multiple factors at different levels, including the individual, family, and peers, as well as broader context of schools, community, and public policies. Abundant lectures has focused on individual, family, and peer predictors of adolescent substance use, as well as community factors, laws, and policies. Smoking factors. Single leading preventable cause of death and diseases. They are linked to many deadly diseases and affect middle and high school populations. 80% adult smokers start before 18 years old. Cigarettes, alcohol, and marijuana are among the most commonly used drugs by adolescents between the age of 12 and 17. 18% of high school students smoke cigarettes. 80% adult smokers start before 18. Yes. Center for Disease Control. Decrease susceptible among youth. Healthy risk associated with youth smoking. Lack of community-wide based programs. Risk of smoking, lack of education of health hazard, lack of comprehensive tobacco control policies, youth access to concrete resource for smoking product. This relation becomes stronger at higher grade level, perhaps as function of increasing cigarette use with age in schools serving more affluent student populations. Stress on health but preventable diseases like COPD, emphysema, asthma, cancer, and carcinogen effect. Community involvement. What can parents, teachers, and the community do? Intervention addressing absenteeism, truancy, in middle and high school may help prevent student substance use. Intervention focusing on tobacco use prevention may be more relevant for schools serving more affluent and predominantly white students. How can a community decrease tobacco use among middle and high school students? By involving the community health workers, government stakeholders, community leaders, and offering education, adequate education on smoking. Schools serve as catalysts for more proximal intervention of students with peers, teachers, and other individuals that may promote or deter students from using substances. Various factors at the school level, such as structure, climate, and policies, and their enforcement, affect students' perception of norms, interaction, that, and any behavior. Peer pressure, youth, and the community must get involved. Higher student-teachers ratio in late high school were associated with more students smoking cigarettes, which may reflect less adult supervision and monitoring of students, enabling smoking on school grounds. What we learned from all the slides: smoking affects community health, education programs, middle school and high school students, healthy living after smoking session. School with more poor and non-white students had lower rate of cigarette smoking in high school, higher rate of cigarette use in late high schools. School sizes were not related to student substance use. I hope you enjoy my lecture. Thank you.